I'd like you please to welcome with me Andrew Bellier, who's going to talk about the Spanish influenza, exploring Kingston's deadly epidemic of 1918. Thank you. Thank you, Andrew.
Thank you everyone for coming tonight. Thank you to the Museum of Healthcare, to the estate of Larry Gibson, to Kiersey, to Jenny, to Max, to Kathy, to everyone who supported this work, to Dr. Arrington, thank you for all of your guidance over this summer. I really enjoyed my work, and I hope that over the course of tonight that you can learn a little bit about what the Spanish flu was and maybe have a few laughs as well. I wanted to start with this silly little poem because I think it reflects well on kind of where the flu went. This was a poem that was developed by children in 1918 as they were dealing with the Spanish flu, and they would jump rope to it. It was so synonymous with everyday life that you can picture, little 10-year-old girls in the street singing along, I had a little bird, and doing their double dutch or whatever it's called. So this is kind of opening us up here. So I'm going to start us off by telling you a little bit about what the Spanish flu was to get us all on the same page. And then I'm going to break down what happened here in Kingston because it's a pretty cool, unique area for the disease. So what was the Spanish flu? Well, the Spanish flu was like many flu viruses that we have now. It was influenza. It was a flu virus that was contracted by contact with the mucous membranes, so spread by your sneezing, spread by coughing, spread by talking to people. If your snot was wiped on a door handle and someone came by and opened the door, then they would get that, just like today. There were two particular elements, though, that made this flu so bad, and for many of you, I'm sure you've heard of Spanish flu. And this is because it was global, in that there's only one place in the entire world that is being recorded as having not had cases of Spanish flu, and this is a very remote island in the South Pacific. It was absolutely global. The second reason is that there was a high propensity to develop into pneumonia. So influenza, although lethal, was not the real cause of death in most cases. In most cases, it was actually pneumonia that developed as a result of the flu. So we see here with this rapid global spread at the end of World War I in 1918, as soldiers were traveling all around the world, people were going home, the flu spread much more easily because of it. But where did this flu come from? Well, it's a mutated H1N1 virus. And for those of you who may remember 2009, H1N1 will certainly ring a bell for you, as we had another swine outbreak that went worldwide as well. So it's the same virus, just a different variant, and as I said, it's a swine flu. And so it comes from pigs, and the mutated version of the virus is transmitted to humans because we live in such close contact with animals in many farming communities. And as soon as it transmitted into humans, the story is over. The rest is history, so they say, and it was all around the world. Now, there are two real theories as to how it spread and where it came about. And the first of which is what we're looking at here. This is what we call Camp Funston. It was a military camp in Kansas. And one of the traditional, very widely believed ideas is that the virus mutated on a pig farm in Kansas or in the Midwest somewhere, made its way to this camp here, and from there went overseas with soldiers going to the front lines. The trenches had really bad sanitation, and so there was no stopping the disease there, and it went around the world. The other idea, though, that National Geographic has really been working on recently is that it was developed in China. Because in 1917, 1 year before the Spanish flu, they had an upper respiratory tract infection that went all the way across the country. So that was 1 year before. And then the following year, when the Spanish flu hit, China actually had one of the lowest mortality rates in the world. And that, as you can imagine, might be because they developed a bit of a resistance the year prior. So, as with many things, we don't really know the true cause or the true origins of it, but there are some theories circulating out there. So why is it called the, quote, Spanish flu? Well, I wanted to introduce that topic with this little comic here. This comic was produced in 1918 by a Spanish comedian, and it says up here at the top, sprinklings of war, and then down at the bottom here is this aristocratic woman saying, "Without fashions coming from Paris, I don't know what to put on." And this reflects the animosity that Spain faced with other nations during the war. So Spain was neutral during World War I, which meant that it had uncensored media. Because of that, all of the cases that were coming through, all the people that were dying, they were open about it and they were honest with the world about it. Other countries like Germany, France, Britain, they wanted to save face. They didn't want to appear as being weak, and so they hid all of the flu cases and all of the people that were dying throughout 1918. Spain, on the other hand, they didn't really care about having a strong persona. They were open about all these cases. And because of the fact that Spain was neutral, there was quite a lot of animosity held towards them. The French, all these countries, the British, the Germans, were pointing fingers at the Spanish whenever they could, because it was that easy middleman. And so they said, yeah, you know what? Spain has all of these cases of influenza. We don't like Spain. It's the Spanish flu. We'll blame the Spanish. But really, this has nothing to do with the Spanish. Speaking of war, what was the global impact and how did the war impact it? Well, worldwide, there were about 500 million cases of influenza. That reflects about a third of the entire globe's population becoming actually infected with influenza. So there are innumerable more people who would have had influenza but being asymptomatic. And so this number is likely even greater than a third of the entire world's population. In terms of those who died, the numbers are between 20 and 50 million, some believe. Other estimates put it 50 to 100 million people who died. And we're talking about a time frame of about 3 months. Really, it was October, November, December 1918. You're having potentially 100 million people die in 3 months. Put that into perspective, the war that's just ending at the time killed about 16 million people. So over 5-fold greater deaths occurred in just 3 months, potentially. Now, a lot of people question these numbers, and I heard a number the other day. We were sitting in class, and they were talking about the Spanish flu, and the professor said 16 million people died, and I bit my tongue as I said, no, that's an underestimate. And the reason that it's an underestimate, people believe, there are 3 kind of main reasons that people associate with it. One is that most people in 1918 were treated for cases of flu, common cold, pneumonia. They were treated at home, and they didn't go to the hospital. And if you don't go to the hospital, it's not going to be recorded in the hospital system. So if you die, the cause of death is much less likely to be recorded. And that leads me to the second point, which is that epidemiological recording was much less sophisticated at the time. And the third and most important reason is that influenza at the time was not reportable. What I mean by that is that if you went to your doctor with a case and say you had influenza, your doctor was going to help you out, was going to prescribe and hopefully fix you up, but he wasn't going to report that. He wasn't going to write it down. It was kind of like a cold. You've got a cold, but it's not like you're diagnosed with a real disease. By the time people understood that, wait, influenza is serious, we need to take control of this, it was long gone and it was all around the world. But this global impact was felt much closer to home as well. And I want to introduce everyone here to Dr. Archibald Williamson. And this man, besides owning a fantastic mustache, was also the medical health officer here in Kingston. Medical health officer, beyond doing the standard doctor stuff, like going to see patients, was also in charge of the policy level in Kingston. So whenever there was a problem, whether it be a typhoid epidemic or influenza outbreak, he was in charge of dictating what Kingston did in response. Not really a job that many people here would want, I can imagine. And the best thing, or maybe the worst thing actually, is that he had no idea what to do. Because influenza was spreading, cases were multiplying, it was exponentially getting worse and worse and worse throughout October, and he had no idea what to do, and nor did anyone else. This here is an article that was published in one of Kingston's newspapers entitled "How We May Avoid Spanish Influenza." This was published on October 4th. So this was right at the start where people are starting to pass away, people are starting to really get sick and stay home from work, but it has certainly not reached its peak. And I want to highlight here at the middle section where it says, Dr. Williamson states that the disease is transmitted from secretions from the nose, throat, throat and bronchial tubes, and says that the people should avoid public assemblies. The preventative is to spray the nose and throat regularly with permanganate of potash solution of 1 to 2,000 parts. If these precautions are observed, the disease may not spread as it has in other places. I absolutely love that final part. If you spray your nose a little bit, Kingston's going to be fine. No one's going to get the flu. Of course, that couldn't be further from the truth. So surely that'll work, right? We'll spray our noses and everyone will be fine. Well, not quite. Later in the day, or the same day rather, later in the paper, we see this big notice. So in case you didn't see the small font, we'll just increase the font size and that'll help get rid of the flu. Nope, not quite. But we're going to recommend that citizens avoid public assemblies. And that was actually a really good recommendation. As we would say now, if you have the cold, if you have the flu, stay home from work. Don't get other people sick, please. Now there's a bit of public opinion where people start to chime in here. This is now October 7th, so 3 days later after that first article I showed you. This is still in the Daily Whig Standard here in Kingston. And there's a quote taken from the Galt Reporter, and the Galt Reporter is based out of Cambridge, Ontario. They say, a medical authority says one way to avoid Spanish influenza is to get in the sunshine. But during the past month, it has not been easy to find, quote, a place in the sun. I love that final part. What does that mean, a place in the sun? Are they quoting some sort of medical professional who's saying, oh yes, my patients, they're all very ill because there's no sunshine? I don't think so, but I found that quite funny. Hey, not all is that bad though, because the Germans have abandoned the goose step and now we've moved to the foxtrot. So it's not all bad here, folks. Let's fast forward now to October 16th, 1918. And when I say that date, you should all go, ooh. Because October 16th, 1918 was the day where all the public places closed down. This is when Dr. Archibald Williamson finally put his fist down and said, we need to close these public places. So, included in these places that need to be shut down are theaters and moving picture halls, churches and chapels, including Sundays, all schools, public or private, including Sunday schools. Hospitals are closed to visitors. The courts were closed to everyone except for those who needed to absolutely be there for the case. And the board advised for people to please not use streetcars, avoid these public places. So this was the first real step that was taken, the first real action at a policy level here in Kingston. To this day, this shutdown, which shut down Queen's University as well, this is the only reason that Queen's has ever been shut down for a medical reason, were 2 weeks following this notice here. So it was 2 weeks following October 16th, 1918, and I want you to all please keep that idea in the back of your mind throughout this presentation, that it was really that final portion of October that was really the worst, and a lot of what I'm going to be talking about refers back to late October in this 2-week period where everything was closed. That day, there was also the Ontario Emergency Volunteer Health Auxiliary publishes this notice, which is now from the provincial level. It's published by Dr. John McCullough, and Dr. John McCullough was Ontario's equivalent to Dr. Williamson, so he was the provincial medical health officer. And he wanted to get women involved. He wanted to essentially create pseudo-nurses who would go to homes, who would go to the hospital and help out because all medical professionals were very strained. It says here that young women of education are urged to avail themselves of this unique opportunity to be of real service to the community, as if they hadn't been before, which is of course not true. But these women who then entered into this health auxiliary were deemed Sisters of Service, or SOS. And these women were in charge, if they passed the course, they were in charge of going to homes. There were 156 women here in Kingston who took up this job. They made over 1,200 visits over the course of 2 weeks. So you're talking about hundreds of visits per person, or upwards of 100 visits per person. They saw more than 200 families, more than 600 people, and for a total of 1,200 visits. But not everyone was happy that there were closures. People understood why closures occurred, but it wasn't great for everyone. This here is a letter that was written from the president of the Princess Grand Opera House, which is on Princess Street still. And it was written to Dr. Williamson saying, look, we need to stay open because our business relies on this time of year to bring the funds in. He highlights September, October, and November are the only months in which the managers of theaters are at least fairly sure of some profit and a reasonable rate of interest on their investments. So it was hard for Dr. Williamson. I don't think any right person would want to do this, but understanding the situation, I think it was ultimately the right choice. So we've heard a lot of negative things here about the flu, but what about some of the treatments that people have? Well, I'm going to break down some treatments, and there are some good ones, some bad ones, and some funny ones. So let's jump right in. One of them is an herbal remedy that people use, and still use to this day, of cinnamon. And it's not cinnamon like this. If anyone recognizes this kind of scenario of what's happening, this man is filming himself doing what's called the Cinnamon Challenge. Cinnamon Challenge is this new phenomenon where stupid young people film themselves taking powdered cinnamon and trying to swallow it. Of course, that's almost impossible because powdered cinnamon dries out your mouth so quickly that you can't possibly swallow it, and you end up doing something like that. It wasn't like this. No, they weren't partaking in the Cinnamon Challenge. They were taking cinnamon oil, combining it with water, milk, and they were taking this to relieve congestion in the heart. Another treatment was aspirin. Now, aspirin was used up until 1963 when Reyes syndrome was discovered. Aspirin was used to treat fever. We know now that you would never ever treat fever with aspirin. And one of the main reasons that you don't do that is because Reyes syndrome develops often in children who are given high doses of aspirin. This leads to brain neurological conditions, this leads to liver failure, and we're talking about children ages of 10 who are given these mass doses of aspirin following the flu that are often dying in about 30 to 50% of cases in Reyes syndrome. So now you never give your kids aspirin when they have a fever, but they didn't know that then. This one's great. This one's one of my favorites. Ayer's Cherry Pectoral. As you can tell by the image here, these two young girls, it was marketed for children. This was a cough suppressant. And in this cough suppressant, they had a miracle drug, and we call that miracle drug heroin. They had 83 milligrams of heroin in this bottle here. To put that into perspective, a lethal dose of heroin is about 30 milligrams. So we've got about 3 lethal doses. These are adult doses as well of heroin that would kill whoever took it in high enough doses. Children, of course, that would be lower. And so we had many children who were dying of taking this cough suppressant. There's a great Museum of Healthcare article that was written by a colleague of mine this summer, and so if you're interested, you should look into that a bit more. But in terms of the Spanish flu, this treatment was really a great cough suppressant when you think about it, right? The other thing, though, was it wasn't just a cough suppressant, it was a heart suppressant and a life suppressant, and it was, kind of crushed your soul as your children passed away. But one thing actually did work, and that was blood transfusions. This here is a diagnostic set. A little plug here for the Museum of Healthcare. This is actually in the museum's collection. This is a diagnostic set which is used by doctors. They would throw it in their bags and they would go around to see patients at home visits or on the hospital wards. And this is used to do a myriad of different things, but one of them is to do a blood transfusion. And blood transfusion was the most effective way to reduce fatality, and pretty much the only proven way to reduce fatality. What was done is you remove a convalescent patient's serum. Convalescent patients were those who had influenza but were recovering. So you'd remove the cells, you remove the white blood cells, the red blood cells, and the platelets, and you just leave in some electrolytes, antibodies, antigens, and hormones. And you're going to take that serum and then you're going to transfuse that into a patient who's either sick or who you wanted to prevent from being sick. And there was a meta-analysis done in 2006 on all of the literature that was published between 1918 and 1925 on blood transfusions that were done. So this big literature review, and they came up with 2 pretty big conclusions. So they had 1,700 patients across all of the studies they looked at. And if you received any transfusion at all, you had 16% fatality if you had a transfusion, but almost 40% if you didn't receive a transfusion. Even more importantly is that if you developed pneumonia, it was important to receive the transfusion early in that diagnosis of pneumonia. So if you had an early transfusion, there was a 19% chance, or a 1 in 5 chance, that you would die within 4 days of pneumonia diagnosis, as compared to 60% if you received it after 4 days. So the transfusion did work, although this was quite a timely procedure and it was expensive and this equipment wasn't readily available. So unfortunately, not your average Joe could have their transfusions done. Interestingly, transfusions kind of took off here because of 3 major kind of discoveries or new events that occurred. The first was the discovery in the early 1900s of different blood types. Of course, we know now that you need to have matching blood types if you're transfusing blood. The second is an anticoagulant called sodium citrate, and you need that to prevent the blood from congealing, and also the modern refrigerator kept things cold. Another treatment was produced here at Kingston by a man named Dr. Guilford Reed, who went by G.B. Reed. He was a professor in the Department of Pathology and Bacteriology, and he was researching the potential vaccine usage here. Many people were doing this, and many people failed, but he was convinced that he would figure it out, and so he took the sputum of convalescent patients, of those who had recovered, and he looked at all the bacteria that were in there using the most powerful microscopes at the time. And he found that in 94% of all of the sputum that he got, that there was this bacteria called Bacillus influenzae. And that's what they named it afterwards. And so he thought, oh, excellent. This bacteria here, this must be what's causing the flu. So he made his little vaccine and he injected it into, who better than Queen's medical students? 193 of them, in fact. Why do you have to go to guinea pigs when you have real medical students at your disposal? And what he didn't know is that that bacteria causes pneumonia, not influenza. So he thought he was going to get at the cure, but he was in fact kind of giving pneumonia to these medical students. There was, however, a little bit of promise in what he did here. These are some of the results that he published. So we're looking at the top of those who were not inoculated, and I want you to focus on the right here, the percentage of cases. So the cases in October 1918 from those not inoculated was 45%, relative to those who were inoculated down here in October 1918 of just 12%. And we have a much larger sample size down here as well. So yeah, there is something to be said for this vaccine that he developed. Although it wasn't really what he was getting at, he wasn't developing a cure necessarily here, but it did help. Unfortunately, though, all these vaccines that were being produced couldn't be produced quickly enough, because within 3 months, influenza was gone. By December 8, 1918, it was over. And there were so many people producing so many different vaccines that how are you to know who to trust? Interesting fact about Dr. Reed. He's pretty well known, actually, globally at the time. He was one of Canada's leading researchers in biological warfare. He was hired by the Canadian government during World War II to essentially figure out how he could poison other countries. In Canada, or at Queen's rather, at Humphrey Hall, which is the psychology building now, the attached crane building was where he had his main lab. You'll recognize this potentially from an old door that was there. And he had this defense research board set up there. He had over 14.5 billion lethal doses of Botox upstairs in this building, as well as mass-producing anthrax. So this was actually guarded day and night, 24 hours a day, by men with guns because they did not want anyone getting anywhere close to there. I've been told and I've read that it's long gone. It was shipped to Alberta so they can have all the anthrax they want up there. So there were a few hospitals that were established here because of the war and because of influenza. One of them was the Great War Veterans Association Emergency Hospital. This was set up at 67 Princess Street, just downtown, and this was mainly for women and children who had influenza. So there were a total of 57 patients here from 22 families, mostly children, a few mothers as well. But this was one of the smaller ones, and this was set up specifically to manage influenza. However, there were lots of other hospitals in Kingston at the time. And as I'll come to later, that was one of the main reasons why Kingston was the focus of my talk here. One of these hospitals, or two of these hospitals rather, is Sydenham and Ongwanada military hospitals. And I want to draw your attention to this really, really cool image here. This is, I'm borrowing this from the city of Kingston who put this together. What you're looking at is the black is the 1918 map. So does anyone recognize where this is? This is King Street. Can anyone tell me what's here? Any guesses? Yeah?
It's where the Isabel and Tet Center are.
Exactly. Yeah, this is, I don't know if you can see it really, but you can see it's kind of written there. You can see Bader. This is the Isabel Center nowadays. But back then, it was actually first used as a brewery that was run by the name of James Morton. And he had this big, big brewery going on where the Isabel is now. And what happened is one night, a watchman on duty that was protecting the brewery was murdered on the site. And from there, this was the late 1800s, the building was bought and sold by different companies because no one really wanted there because there's a rumor that the ghost lurks there. And so no one wanted to set up shop there. And in the early 1910s, the Canadian government expropriated it and turned it into a military hospital. There's also a really nice yellow house that still stands just west there, and that was the second military hospital. So you can still see that house if you drive by, but there were two military hospitals set up that treated about 70 patients who had influenza. This is a picture here for those who haven't been. This is the Tet Center, and this wall here, I tell you this just because I love beer, this wall here was the original wall of the brewery. Another military hospital, closer to home, just across University Street here, was Queen's Military Hospital. Now, when war broke out in 1914, the Canadian government realized they were going to have a heck of a lot of people returning who needed somewhere to recover. Lots of these ill soldiers. So the Canadian government put this proclamation out saying, we need your help. And they specifically asked Queen's, saying, what can you do to help? What can you provide us to help create a hospital? And the Queen's faculty donated the space of Kingston Hall. Queen's students at the time were in charge of Grant Hall. And so they said, yeah, we'll donate Grant Hall as well. We'll donate that space for you. And so what happened is Grant Hall and Kingston Hall was turned into what you see here on the right, which is a military hospital. These photos are taken from the 1919 AMS yearbook. And on the left, this is what Grant Hall looks like if you go in there today, where all the graduations take place at Queen's. It says, Grant Hall as it was and will be. These are captions from the yearbook of 1919. And then over here it says Grant Hall as it is now, with all of these beds. And what they actually did in Grant Hall is they built a superficial second floor. So they took this balcony here, and they went all across, and they made a second floor there. What you're looking at here is actually the main floor of Grant Hall with all these supporting beams. And they left this open space here to allow some natural light to come into those patients who were down on the bottom here. But they had over 600 beds that were here, and these were mostly for military men returning. But what happened at KGH was so overwhelmed with patients. Not only were there some soldiers, but you had so many influenza cases coming in that they actually had beds of people who were very ill and dying in the halls. The halls were apparently just littered with beds. And as you can imagine, people were trying to do anything they could to get out of there, and hence why influenza patients were sent to this place, which is originally a military hospital. So it kind of became a military/influenza hospital. But what about the biggest treatment center here in Kingston, Kingston General Hospital? It was a relatively new hospital at the time, so people were excited to come. And what I want to show you here is some of the data that I was able to come up with. And so on the bottom here, we're looking at dates starting the 1st of October 1918, going all the way to February of 1920. And on the y-axis here are the number of admissions. And what we see is that early October, as I was telling you about, October, November, we see about 20 admissions per day for several days in a row. We're talking about Kingston here. Kingston has 22,000 people at the time. So when you're admitting 20 patients per day, that adds up very, very quickly. This pattern follows the pattern that we typically see, which is a big blip in October, November 1918, a smaller blip in the spring of 1919, and then a tiny little blip in 1920. And that was kind of the standard, what we see across the world with influenza. There were kind of 3 waves of it. Hotel Dieu had very similar numbers to this. They had 250 admissions for influenza and pneumonia. That's more than half of what they got over the entire year. Those 250 were in October. So October was not a good month to be here in Kingston. This is the age here on the y-axis, so from 0 up to people in their early 80s, and then the number of cases that were admitted at KGH for influenza or pneumonia. And this follows the typical pattern and brings me to a very interesting point, which is that the Spanish flu was very unique in that it affected mostly healthy people. Mostly people in their 30s and 20s who were otherwise very healthy. Because what happened with influenza is it produces what's called a cytokine storm. And a cytokine storm is when your body overreacts to an infection that comes in. That's about all I can say. If you want to know more, you can ask a medical student, don't ask me. But it follows this typical W pattern, which is we have young children infected, mostly people who are affected are in their 20s, and then elderly you don't really see here, but typically you saw it in the elderly as well. What about Kingston as a whole, though? Kingston as a whole, though, was published by this man, Dr. John McCullough, who we were introduced to earlier. He is the provincial medical health officer, and he publishes these results in 1919. And what I want to draw your attention in particular to is Kingston, right here. See the population there? 22,000. It's very, very small. Go all the way across, they had 145 deaths in total, but look at that death rate per 100,000 people. 644 deaths per 100,000 people. Compare that to what we saw in Ottawa, which is 548. Or what about Montreal, which is 489? Kingston had the highest mortality rate per 100,000 people in Canada. Which makes you ask, what on earth is happening with Kingston? And it's not even really that close, right? Kingston has about 100 deaths more per 100,000 people. In the States, it's a little bit of a different story. Pittsburgh and Philadelphia here, we go across 721 and 819. But look at the cities that they're coming from. Pittsburgh and Philadelphia, not exactly the cleanest cities. Huge populations relative to what Kingston had. So you have people living in a lot closer proximity to one another. And so you'd think this would encourage the flu to spread. But what made Kingston so different? I asked myself this question, and this is kind of the meat and potatoes of my research, if you will. Well, what made Kingston different? One thing was they had free medical care. And this is unique to Kingston, because Kingston, the KGH hospital, was very closely affiliated with Queen's University in this beneficial relationship going both ways. Queen said, we want to have somewhere for our medical students to practice, and KGH said, all right, great, we'll send them our way, and they can help us with all of these cases that we're getting. And so this was unique to Kingston, and I think it was replicated a few other places in Canada. But for the most part, you didn't have this relationship. Most people had to pay for their health care. Nowadays, we take this for granted here in Canada. But at the time, most people didn't go to the hospital, in part because the hospital didn't really know what to do, but also because you were going to have to pay for whatever treatment that you were provided. This here is the class of 1919 medicine. And as you can tell, they're all men, and I want to highlight a few interesting things about them. Now, this was a 5th year class. Medicine at the time was a 5-year program, and these men were sent during late October. They were sent around Kingston. They were sent as far as Collingwood to Sherbrooke in Quebec. They were sent all over to help during these 20 days that Queen's shut down, because of course they had nothing to do but help. I want to draw your attention to this yearbook photo here. Look at this man in the front here. He actually has a skull and crossbones that he's just set up in his lap. Or this skeleton here, who they've set up smoking a pipe. Or this skeleton here in the back that these two gentlemen have kind of slung around their arms like that. It's certainly a different treatment of respect than we see nowadays, but that gives you a sense of kind of what their morals, I guess, were at the time. So, not only free medical care, but Kingston served a very large catchment area, and still does to this day. It's the largest tertiary center between Toronto and Ottawa. And so people from all over were coming to Kingston for influenza. Cases as far away as Montreal and Ottawa, but much, much closer to home here. I suspect these cases from here over near Lake Huron, up in Ottawa, Montreal, these are probably family members who are visiting. There's actually one case from rural Saskatchewan. I don't think that Kingston was the closest place that they could go. But look at all of these places. We have people from Amherst Island, from Prince Edward County, from all the way north in Renfrew. People were coming from all over to Kingston. Camp Berryfield is another reason. CFB Kingston is part of what makes Kingston famous nowadays. But in 1914, Camp Berryfield was formed. Camp Berryfield then became CFB Kingston later on. But this brought a large number of military people to Kingston. When you have any number of large people coming to a single small city, you're bound to end up with some kind of condition and spreading of disease. And that's exactly what happened. Geographic location. Kingston is at the east end of all the Great Lakes. It's at the west end of the St. Lawrence. It's the perfect spot for people to stop off before they head east across the ocean or as they're coming west from the Atlantic. And this is, again, bringing more people to Kingston, helping spread the disease more and more. And my final point is that there were 6 hospitals in the city. There were 6 of them. There was Kingston General Hospital, there was Hotel Dieu, there was Queen's Military Hospital, there was Sydenham Military Hospital, there was Anguinata Military Hospital, and then there was the Great War Veterans Association Emergency Hospital, all serving 22,000 people. So, what did I conclude? The mortality rate in Kingston was the highest in Canada because many people were dying in Kingston but not contributing to the local population. You have all of those people. Go back to the map. All of these people, for the vast majority of them, they are not from Kingston. But they are coming to Kingston, they are dying in Kingston, therefore they are registered as a death in Kingston, but they are not Kingstonians. So they're not adding to that 22,000 people population, but they're contributing to the deaths. So that is the reason that I believe Kingston had the highest mortality rate. So what did we learn from the influenza? What did we learn from this devastating condition? Well, Health Canada was formed. In 1919, a federal Department of Health was formed. At the time of the Spanish influenza and during World War I, there was no, believe it or not, there was no federal unified health approach. It had been 1867 was when we became a country, and yet it took about 50 years for us to even form a national united approach. And this is because doctors were absolutely fed up. At the end of World War I, and after having dealt with Spanish influenza, they were so tired of the fact that they didn't have any sort of guidance. There was no unified approach that would say, you do this, you do that, and doctors, this is what we're going to recommend you do. Cities, this is how we recommend you respond. And so the Department of Health was formed, which eventually became Health Canada. We also learned the value of working together, planning together, and in large part through that we learned about blood transfusions. With the spread of scientific articles being published more and more, there were new journals being formed every single year. This really helped people understand each other's situations throughout the country and helped us work together in future as we realized that, yeah, we need this unified national approach. I want to end off here with this advertisement. This is one of the funniest advertisements that I came across. There's quite amusing parts of researching newspapers. And this says here, a gift for all the family for all year round, a $45 phonograph. This machine guaranteed to drive away the Spanish flu. Stay at home, keep away from the crowds and theaters, ride a bicycle, save gasoline. Have your theater part on your phonograph. Doctor's orders. Hear the new October records for your phonograph, and you will sure take home a few, and you will never know you had to stay in nights or miss the gasless Sundays. Because remember, this is still during the war. Yeah, they had gasless Sundays. Have you heard K-K-Caddy, the new camp song? You will like it. So this was a local ad published here in Kingston. And as you can tell, as with nowadays, companies are always trying to do their best to take advantage of diseases. They're trying to capitalize on people's illness, and people weren't that different 100 years ago, right? So I want to thank you all so much for listening. I hope you learned a little bit. Hope you had a few laughs, and I'm welcome for any questions that you might have. Thank you.